Are you suffering from prostatomegaly and don't want to get operated? Doctor suggested you for surgery of that prostate, but you don't want. Then you are at the right direction. Just watch the full video and you will get the solution. Hi, I'm Dr.Garima Gaurav Agarwal presenting you the video of this topic, prostatomegaly, and the solution for this disease. Let us first understand what is prostatomegaly or BPH, that is benign prostatic hypertrophy. So here, the size of the cell increases, not the number increases. So the question arises, is it a cancer or does it lead to cancer? So the answer is no, it is rare. Why? Because in cancer, there are multiplication of cells, that is the number of the cells are increases. But here in this prostatomegaly or BPH, that is benign prostatic hypertrophy, the size of the cell increases. So it is a benign disease, not a cancerous one. So if the size is between 35 to 40 gram and symptoms are not more, not much, and PSA is less than 4, it is easily curable. But if the PSA is more than 8, you need to consult a surgeon for surgery. Otherwise, below 8, that PSA, if it remains under 8 or between 4 to 8 or below 4 with severe symptoms even, and with the size more than 35 to 40, 50, 60, it can be easily curable with this pathy, that is homeopathy. Now let's understand what are the symptoms of this prostatomegaly. It is seen in males only because prostate gland is present only in males. So they take time to urinate. Beginning of urination is difficult and ending of urination is also difficult because there is dribbling of urine at the end of micturition or urination. So there is a split of the stream. So these are the symptoms. Along with this, there is frequent urination. Patient has to wake up at night many times and has to go to washroom even after an hour or two. So there is frequent urination, there is fullness of bladder even after urination, and patient wants to urinate again and again because there is continuous sensation that there is something inside the bladder now even after micturition or urination. Now let's talk about the diagnosis. So USG, that is ultrasonography of the whole abdomen is required. Along with that, PSA antigen, prostate specific antigen test is required because if it is more, it may lead to cancer. So PSA antigen test is also important with this. We have many cases of prostate, that is BPH, a person who had prostatomegaly and the size was 95 grams. After taking proper homeopathic medicines, that size has been reversed up to 58 gram right now, and the treatment is ongoing. So if you want proper consultation, you have to go throughout the case. What is that case? That is, a person needs to give his 2.5 hours and detail history of his childhood, his physical generals, his schooling life and everything. Whole case is required for a single patient, because what we do after that case, we analyze the case and the medicines are to be chosen because of that individualization for that particular person. And after then, when we prescribe this medicine, that is called as constitutional medicine, and that only medicine can be helpful in curing such cases. Here I am going to discuss you about some of the homeopathic medicines which can give you symptomatic relief but not the complete cure. The first medicine is Varita Carb. It is especially for the old age patients, that is above 60 plus age, whose memory is weak and the person becomes weak, lethargic, and urine gets dribbled, there is weak flow, weak stream, and the flow is not good while urinating. So Baryta carb can be helpful in such lean, thin, lethargic patients and especially having weak memory. The next medicine is Conium maculatum. It is for especially physically active persons but sexually they are weak. They cannot perform sexually well and they are losing their weight, emaciated, having loss of appetite, and urine flow gets decreased in these patients, and there is a bladder retention, that is some urine has been remained inside their bladder even after evacuation. So in such cases Conium mac can be helpful. When there is continuous desire to pass urine at night, the medicine comes out to be Subal-Cerulata. This is one of the best medicine for getting symptomatic relief in cases of BPH. But when there is difficulty in passing urine and blood comes out with urine, that is hematuria, and there is difficulty in passing urine, there is too much pain, tenesmus in abdomen, and the medicine comes out to be Solitago. And when there is benign prostatic hypertrophy along with cystitis, that is inflammation of the bladder, or kidney issue, or with liver issue, means having some gastric trouble, then lycopodium can be helpful in such cases. That's all for today. You can consult with us online throughout the world. Now, the consultation is not so far. Video consultations as well as audio consultations are available throughout the world, dealing international clients since so long. So you can contact me from anywhere or you can visit our clinic at MATHURA, Krishnanagar. For any queries, you can contact us at our WhatsApp number as well as on our calling number. So we will meet soon with a new topic, new video. Till then, stay connected, stay healthy. Bye-bye.